Hey everyone, you are joining the webinar titled Understanding Infant and Early Childhood Mental Health for Families. You have an activity packet that corresponds with this webinar, and so if you will take out that activity packet, and I will reference different items on that activity packet as we are going through the webinar. So on this slide, it notes, and it is in childhood that we learn to love. And this is a sentiment that is important and will be a theme that runs throughout the presentation today. So today, I hope that you will be able to, at the end of this webinar, clearly define infant and early childhood mental health, describe the importance of the caregiver-child dyad in promoting infant and early childhood mental health, describe the impact of early trauma on the brain, and describe how to promote social emotional competence in young children. So first, if you will go ahead and pause the recording and take a few minutes to complete the pre-survey. That will help us understand whether or not this webinar was helpful in you gaining new knowledge about infant and early childhood mental health in the home. So you can pause the webinar and use your camera to take a picture of this QR code, and that should take you to the link for the survey. So once you are done completing the survey, you can restart the webinar. Okay, welcome back. So we will keep going. Thank you for completing that pre-survey. So now if you will look to your activity packet, and under item 1, could you note how you define mental health, just mental health in general for adults, maybe yourself, older kids? How do you define mental health? Give you just a minute to do that. So the World Health Organization defines mental health as you see on this slide. So they define it as a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. Another definition of mental health here is from Stanley Greenspan, Dr. Stanley Greenspan, founder of the relationship-based DIR floor time method. And he notes that mental health is a full range of life's emotions at each developmental phase of life in a broad, comprehensive, and stable and deep manner. So when we look at infant and early childhood mental health, there are certainly similarities in the definition of infant and early childhood mental health with these two definitions that you see here. There's also a distinct component of infant and early childhood mental health that isn't necessarily reflected here. So let's look at what is infant and early childhood mental health. And so as we are going through these definitions, you can fill in the sentences number 2 on your activity packet. So the first definition here is from the World Association for Infant Mental Health, and it notes that infant and early childhood mental health is the ability of children to develop physically, cognitively, and socially in a manner which allows them to master the primary emotional tasks of early childhood without serious disruption caused by harmful life events. Because infants grow in a context of nurturing environments, infant mental health involves the psychological balance of the infant family system. The second definition here is from 0 to 3, the Early Childhood Technical Assistance Center, and it notes that infant and early childhood mental health is the developing capacity of the child from birth to 5 years old to form close and secure adult and peer relationships, experience, manage, and express a full range of emotions, and explore the environment and learn, all in the context of family, community, and culture. So in both of these definitions, I highlighted 2 of the most important components of infant and early childhood mental health. First, IECMH, which I'll refer to that now. Infant and early childhood mental health is IECMH. So first, IECMH is concerned with building social emotional competence in young children. And then second, The field of IECMH really recognizes that social emotional competence is built through child caregiver interactions in a healthy family environment. So the context of infant and early childhood mental health is incredibly important. Early childhood mental health is really conceptualized in the context of the child caregiver dyad. So young kids cannot exist without a caregiver, and then their emotional regulation is really closely tied to that of their caregiver. And so these pictures are, these first two pictures particularly are reflective of the importance of the child caregiver context when considering infant and early childhood mental health. Then the last photo is not reflective of how infant and early childhood mental health is conceptualized or practiced. So we really think about infant and early childhood mental health within the context of that dyad. That dyad is so critical. So to kind of further highlight the importance of this dyad, any professional who's working with the child or parent is going to be addressing the overall health of the relationship. So if you're a physical therapist or occupational therapist and your focus is on a specific muscle or specific sensory behavior of a young child, you're going to be supporting that child to build that muscle or repair that injury or address that sensory need. And you're also going to be reflecting on how does that injury or delay impact the child caregiver dyad, and you're going to provide strategies and suggestions to the family member for how to maintain that strong relationship with the child in light of the delays and how the developmental delays or injury may impact the relationship between the parent and the child. There are different concerns that therapists may address when working with families and young children where there may be mental health concerns. Some relationship issues that might present themselves include these listed here: regulation issues or challenges in establishing or maintaining that sort of state of calm, sensory regulation. Can the caregiver name the feelings that the child is experiencing, managing stress responses? So how in sync are the family members with the child in terms of their emotional responses to stressful situations, and how capable is the parent in maintaining calm and also modeling stress responses and emotional regulation for the child. And then, the affective tone of the relationship. So how do the feelings and behaviors of each individuals, so the child and the parent, affect the other person? And so really kind of working with that. So why is infant and early childhood mental health important? So infant and early childhood mental health really serves as a foundation for all future development. It serves as a strong base for other aspects, including physical health and cognitive skills, all the areas of child development. It really is the foundation for this. And by the time the child enters kindergarten, they really need to have formed healthy attachment relationships. They need to have learned how to self-regulate their emotions, really focus at a developmental level, and then know how to engage socially with children and adults. And so if there's disruption in their social emotional development, or there's disruption in that formation of healthy attachment relationships, this can impact their ability to learn and thrive as they get older. So it's very important. On this slide, there are also some prevalence data related to the infant and early childhood mental health concerns. So you can see here approximately 9.5% to 14% of kids 0 to 5 experience emotional or behavioral disturbance. So this is a lot of children. And then another way to put that, another way to look at the data is 1 in 6 children, or 17.5% between the ages 2 and 8, have been diagnosed with a mental health concern or a developmental disorder. So there are many, many children who are experiencing these concerns. So if you look at the kind of Georgia prevalence, if you take those percentages from the previous slide and apply those to the number of children between 0 to 5 in Georgia, it's estimated that between approximately 71,000 and 106,000 children between 0 to 5 may need mental health services. So how do we know when a child may be presenting with early mental health concerns? So it's very important for all of us as parents, as educators, as individuals who interact with young children to know the signs and to detect when children may be presenting with concerns. So some signs of early mental health concerns may be, crying spells, just really unable to calm themselves when they're crying, withdrawing from others, maybe becoming more lethargic, a real change in energy level, or self-injurious behaviors. If you'll go to your activity packet now and look at number 3 and pause the video for just a minute and enter in some signs and symptoms of mental health concerns that you are aware of for children birth to 2 and then children 3 to 5. And so they're under number 3 on your activity packet. There's a place for you to enter some signs and symptoms of mental health concerns for these different age ranges. So go ahead and pause the video and then come back when you're done. Okay, well, welcome back. Let's look at some examples of signs and symptoms of mental health concerns of infants and toddlers and preschoolers. So children birth to 3, maybe there are, inconsolable fussiness or very extremely upset when left with another adult, so that extreme separation anxiety, very startled or alarmed by really routine noises or routine situations, inability to establish relationships with other kids or adults, like overly clingy, potentially flat affect. And then looking at preschoolers or 3 to 5-year-olds, maybe, a child's engaging in compulsive activities or throwing just tantrums that are just feel out of control. Maybe they've started withdrawing, or they're engaging in really concerning aggressive behavior. Maybe they have not yet started to talk. So there are, a range of behaviors that may be suggestive of a mental health concern. Now, it is important to note that young children present with challenging behaviors as they're learning themselves and they're learning how to communicate. And so, not every behavior that young children present with is a sign or symptom of a mental health concern. But when there are changes or when there's real extreme behaviors, that may be suggestive of a mental health concern. So when we think about how mental health develops, it really develops before a child is born. That bond and attachment are already forming between the child and the unborn child. I mean, the mother and the unborn child, and so there's a real strong connection from very early between the child and the caregiver. So, children's brains are very responsive to the environment around them. So there are several influences on early mental health, and we'll talk through some of those now. So I am going to provide a brief overview of all 4 of these influences, but I'll dive deeper into attachment and stress. So first, let's look at temperament. So temperament and attachment are the first 2 variables that influence infant and early childhood mental health. And temperament is how a child approaches his environment, or how a baby or child approaches the world. So we commonly hear temperament categorized into the 3 categories of easy, difficult, or slow to warm. And if we've been around a lot of children or raise our own children, we can probably categorize the young children we know into one of these 3 categories. So easy infants are thought to be adaptable, enjoy social interactions, enjoy new experiences. Difficult infants are thought to be more irregular in their mood, very sensitive to changes in their environment. And then slow to warm infants may adapt more slowly to new situations and withdraw from interactions. So the opportunities for social engagement and then social emotional development by default really can be influenced by the differences in the child caregiver temperament, or simply, by just having a temperament that either invites strong relationships with caregivers or doesn't. So again, if you think back about the children in your life, you can probably think of children who really drew you to them, and then also children who were not as open to social emotional interaction. And so, it requires us, if we do have a child who is not as open to social emotional interaction, it requires us to be a little more creative to engage that child and build that strong attachment relationship with them. So that leads us to the second variable here, attachment, which can be influenced by the match between a child and a parent caregiver. It's also influenced by a lot of other variables, including stress and depression and child genetics, which are discussed a little bit later. But attachment refers to the quality of the relationships that the young children develop with their caregiver. So in healthy attachment relationships, caregivers recognize the child's unique characteristics, and the child understands that the caregiver is someone they can turn to for comfort, or when stressed or frightened, or who's going to help them manage their feelings. And babies really develop these attachment relationships with adults that they can learn to count on. So close family members, other, like their parents or other primary family caregivers, and also child care providers. So these healthy attachments may not be formed for various reasons, including parental stress, situational stress, or maternal depression. There's a strong relationship between, caregiver depression and social emotional development, or poor social emotional development. And so, maternal depression can impact attachment, cognitive, social emotional development, and really set the child up for needing some additional support. So maternal and caregiver depression can be triggered by parent stress, and parents experience stress for a range of reasons: financial stress, relationship stress, lack of sleep, job stress, poverty, being a parent, being a caregiver for parents and children simultaneously. Parenting stress does negatively affect relationships with the families, including parent stress interaction or parent-child interaction. So, these negative effects of stress have been noted across all family types. All families experience this type of stress, and some families experience it to a more significant degree that may impact the child's social emotional development. So, temperament, attachment, again, parental, situational stress, maternal depression, or caregiver depression are some of the variables that influence infant and early childhood mental health. So let's dive a little bit deeper into attachment and the role of attachment on infant and early childhood mental health. So here is a definition of attachment from one of the leading attachment researchers who helped establish attachment theory. And this states that attachment is the instinctual responses that mature at different times during the first year of life and develop at different rates. They serve the function of binding the child to the mother and contribute to the reciprocal dynamic of binding mother to child. So very early attachment was very focused on the mother-child attachment relationship, but as we have definitely evolved now into thinking about the attachments between the child and any primary caregiver, whether that's the mother, the father, and another family member, child care provider, and a range of different potential primary caregivers. So here's some additional information about attachment and the relationship between attachment and infant and early childhood mental health. So, again, attachment is the emotional bond or connection between an infant and their primary caregiver. Early attachment is so critically important. And there's, been a lot of research that looks at kind of, what happens when there's insecure attachment as a young child, when that young child gets older, and some of the challenges that they may have when they're older. So here are 4 attachment types that are referenced sometimes in the literature. These are established by a different attachment theorists, and you'll hear kind of variations on the names of the different attachment styles. But secure attachment here listed, this is really defined by the ability to build a long and healthy lasting relationship, anxious, ambivalent. This is where you see a child who may be significantly distressed when their parents or caregivers leave them. Disorganized attachment style. There's maybe challenges in trusting others. They may fear their caregiver, and then avoidant attachment style. They may have either, very, very strict or emotionally distant caregivers, and so they may be avoidant from those attachment relationships or forming relationships with others. So there's a lot that can be done to promote positive attachment and secure attachment relationships. One strategy that's often given to young families is to use what's called serve and return in relationships with between primary caregivers and young children, and serve and return is described here are the steps to serve and return. This is basically the idea that when a child engages you, either by making a noise or by pointing or by looking at you, then the primary caregiver responds to that child by looking at them and making noises and looking at what they're pointing at and commenting on what they're pointing at. And that conversational exchange goes back and forth, even when it's with the baby who doesn't have any words. But there is just that back and forth interaction between the child and the caregiver to promote, again, that feeling of safety, that feeling of responsiveness on the part of the baby. But sometimes kids don't serve, so sometimes our kids don't make eye contact with us, or they don't point at things and want us to look at them, or they don't make noises toward us, or sometimes they do, but we're too tired to engage with them. But I do want to acknowledge that sometimes we're doing everything that we can to engage our child, and they just aren't responding for whatever reason. So here are a few reasons why sometimes kids aren't necessarily serving or to parents or caregivers, and so it may make it harder to form attachment relationships with them. And there are many strategies and therapeutic supports out there to help families where the child may be presenting either with one of the concerns that I'm going to describe on the next few slides, or any other sort of developmental delay that may impact their ability to serve to parents and engage parents, and that social emotional bonding. So some early challenges in social emotional development. One includes excessive crying. So probably familiar with colicky babies. There's also what's called excessive crying, so total crying that surpasses 3 hours per day for more than 3 days a week. Colicky babies are their excessive cry. That's defined by excessive crying plus other features like kind of a high-pitched quality of the cry, some flexed legs, grimacing, or others. So this can make it very challenging for families to focus on that early bonding, because the child is in such distress for so much time, and they're hard to console. Certainly then there are, children with developmental delays, and that may present a challenge to the sharing of emotion between caregivers and children. They may not signal for the caregiver's attention, or they may have trouble sort of co-orienting to social stimuli. They also may present with just different behaviors or different interests that are confusing or hard to engage with. And then, children with autism, which is a developmental disability, may present with similar challenges. So there may be decreased initiation and responsiveness to social interaction. Maybe they are minimizing their interactions with others, and so they may remain more isolated. And so what can be done, when we're supporting the bonding between a caregiver and a young child with a developmental delay or autism, we can make sure that there's a lot of early engagement. We minimize isolated and solitary play, and then there's some great interventions that are rooted in developmental psychology, like DIR floor time, that really focus on that bonding between the child and the caregiver. So, when our children are presenting with challenging behavior, whether their children are at home or their children in a childcare setting, it's important to remember that they are trying to communicate something to us. And we have to help figure out what they're trying to communicate through their challenging behavior. And so children are going to be presenting with challenging behavior oftentimes to try to tell us that they need something more or that they need something less. And we have to figure out what they're wanting more of or wanting less of, and help them meet that need. In behavioral psychology, we talk about, the ways children are communicating their frustration through challenging behaviors, using this term function, or what's the function of the behavior, what's the reason for the behavior. And so we may look and see, okay, are we, as a child engaging in challenging behavior, to say they want more of an adult, or they want more of the adult attention, they want more of that relationship building, or are they expressing a desire to have less of the adult attention, or less of the activity, or less of something? Are they trying to escape from something? Are they wanting a particular activity or a toy, or do they just have a feeling inside that is very unpleasant, and they're engaging in that behavior of concern to express that the feeling they have inside is unpleasant? So we want to do what we can to try to figure out what they're communicating, and try to address the need that they are communicating. So if you'll go now to your activity packet and look at number 5, you'll see the prompts that are on this slide. And I want you to just take a moment, pause the video, take a moment, and look at and answer what messages could this baby be communicating through crying. So you've got a picture of a baby crying here. What might the baby be communicating through crying? And what might a caregiver do to try to figure out the message and respond accordingly? And then what might the baby do to show that we got the message and responded correctly? So go ahead and just take a minute and answer those questions in your activity packet, and then resume the recording. Okay, so maybe you noted on your activity packet that the child is crying because they're wet, or they're hungry, or they want to be picked up, or they're hot, or they're cold. And as a caregiver, you may try to address that need. That you may try to change their diaper, or take off some of their coats, or add the mitten back on, or tie up that hat, or pick them up and hold them. And then the baby, in most situations, will let you know that you've gotten the message correctly and stopping crying. And so we can figure out kind of what the baby needs by trying to meet all of their needs, and they will let us know that they meet their needs. They've met their needs. We've met their needs when they stop crying. And so certainly if children continue to cry, and even though we've tried to meet all of their needs, it could be suggestive of another concern. So when children are presenting with challenging behaviors, it's helpful to think about how we can teach them new behaviors. And we talk about teaching young children new behaviors through the term replacement skills, or replacement behaviors. How can we teach them a different way to communicate their frustrations? With young children, we often have to think about, visual schedules, or sign language, or scripts, different ways that we can teach them new behaviors. And so, there's this quote often out there about behavior that, we're very apt to identify skill deficits in children, and teach those new skills to children when it comes to reading, or swimming, or math, or driving. But when it comes to behavior, sometimes we're more prone to punish or get angry with children when they're not behaving in a way that we think they should. But that's often because they are trying to communicate something to us, and they don't have the skills to be able to communicate what's frustrating to them. So we can teach them new skills, and we want to teach them new ways to communicate their frustration with us. And we want to make sure that whatever we're teaching them aligns with what their needs are. So if they want attention, then or time with us, then we're teaching them how to get that. If they want get away from us or a break from something, then we're teaching them how to get that break. So we want to figure out what they're trying to communicate and teach them a way to communicate that need in a way that gets them that need. So again, if they're trying to get away from something, we want to teach them a different way to communicate that they want to get away from something. And same with if they're trying to get more attention, then we want to teach them a way to get that attention. So so here are some examples of teaching children new ways to communicate their frustration. So let's say that a child is engaging, really crying and trying to get a toy and not able to get the toy. So they're crying, then maybe we can teach that child how to sign for toy or point to toy or say please if they're able to speak. If not, then using a sign. Looking at the next example, let's say a child is done eating and they let us know they're done eating by throwing their food. We could teach a child how to touch an all done card located on their tray or some other, maybe push their tray forward, not all the way off, or push their food forward off the tray or off to the front of the tray, not all the way off, but teach them another way to communicate what they're trying to communicate. And let's say a child is really wanting time with the caregiver and they're screaming to get time with the caregiver. Maybe they can either walk or huddle over to that caregiver and tap on their leg, or they can seek out another individual to get some of that time and love from. So so we want to make sure that, again, we're teaching our children ways that they can communicate their frustration when they are presenting with challenging behaviors, and rather than punishing them, recognizing that there are underlying needs that are not being met. And so, sometimes we, unintentionally might reinforce some of these, the behaviors that children are presenting with. And we need to understand what they're trying to communicate and teach them within more appropriate ways to communicate. So, if a child is trying to communicate that they want to get away from something, again, we support them in a more appropriate way to communicate that they want to get away from something. If they want to try to get your attention, and then we teach them the best way to get that attention. If they want an object, we teach them the best way to get that object. So again, we may need to use visual supports or signs if they aren't able to communicate using words. There are then sometimes the behavior supports or supports that families receive are organized according to our public health model of prevention. So specific practices taught to families as part of kind of universal supports might be dyadic strategies, such as, kind of setting the stage for that interaction between the child and the caregiver, kind of setting it up so that it's going to happen and be successful. Strategies for helping maintain the child's interest and attention, supporting that reciprocal role taking that's similar to that serve and return, but how can we support that kind of turn taking back and forth between caregiver and child? And so these practices can be helpful for all families and really help set the child up for really positive mental health. There's also sort of programmatic and policy supports within our public health model of prevention that may be needed to ensure that families have positive mental health and well-being. So there may be, like Family Medical Leave Act as an example of a federal program or policy that helps support maintaining, positive bonding between caregivers and children shortly after the birth, provides families time to take care of their children if an older child should need some help or support. It's wrong direction. And then there are just other general home-based strategies that all families really can consider to implement to promote wellness. In the home and wellness for their child. So, focusing on healthy sleeping. There are so many strategies and books and websites and parenting classes and so much more guidance related to sleep support for parents of young children. And like, here's just one example of how you can fade into an early bedtime for young children who've established a habit of maybe a too late bedtime. So these strategies can work with most children. We know that some children have such significant sleep issues that families may need to speak with their pediatrician about the range of option for encouraging a full night's sleep. But this is a strategy that all families can work on promoting with their children to ensure that children have the best chance at kind of wellness and well-being. Healthy eating. So, there are many children who engage in really selective eating. And so children may engage in challenging behaviors when it's eating time, where they may be hungry, but they also maybe have aversion to certain types and textures of foods. And so here's strategies for encouraging a healthy eating routine. Again, there's lots of guidance related to healthy eating in the field, and families of children with significant aversion to eating may benefit from the guidance from a speech language pathologist or other people with expertise in eating behaviors. And then providing consistent rituals and routines can create a predictable structure that can guide behavior and really support that emotional regulation of children. And routines create a foundation for families to engage in meaningful activities at bedtime or mealtime. And this can include creating songs for washing hands or brushing teeth, along with kind of chants and celebrations, in addition to full family rituals and routines. So very, very helpful for promoting wellness in young children. And then when we have those universal supports that all families would benefit from, and all children benefit from, and then we have that next level of supports, which include those targeted social emotional supports for families of children who may be considered, kind of quote unquote at risk for social emotional behavioral delays. And strategies within the tier 2 or this targeted tier aim to support families with children who may need more intentional practices to promote their development or to promote their social emotional regulation. And then so, just similar to tier 1, where there's policy and programmatic supports for all families to promote wellness and confidence, there are some targeted programs that target families who might be, again, quote unquote, at risk for mental health or other concerns. So home visiting programs are an example of a targeted programmatic support for families who may need it. And then there may be, children and families that need that more individualized, intensive support. And this is where, some of the examples of how to address individual behaviors that I gave just a few slides earlier are going to be helpful. Also therapeutic support, so that caregiver child therapy, and I'll give a few examples of models of therapy at the end of this presentation may be needed. But if a child and a family haven't responded well to the tier 1 or universal supports or the targeted supports, then they may need these more individualized intensive supports. So then there are, parental stress is something that was touched on earlier, and I'll go into more depth about parental stress now. So oftentimes the impact of parental stress on families can be pretty significant, and it can result in different types of stress experienced by children. There can also be, many reasons why children experience very stressful events. But we organize the stress that children experience according to these 3 levels of stress: positive stress, tolerable stress, and toxic stress. So positive stress describes really when, it's a type of stress that we want children to experience. It's examples of positive stress, maybe, when a child is separated from a parent at a childcare setting, when the parent goes to work, or when the child goes and gets their vaccines at the pediatrician's office. And so those are like normal kind of everyday stressors, and we want children to experience those so that we can model kind of emotional regulation for them in those situations. situations. And so as long as, children have a model of good emotional regulation, they've got a caregiver they can go to and trust, then positive stress is actually something that is beneficial for young children to experience. And then the next level is called tolerable stress. And this is when children may experience something that is less normal and does have kind of a greater level of adversity than positive stress. So this may include the death of a family member, or serious illness, or a natural disaster. And so these situations are very stressful for children and families. But as long as the child is supported by caring and protective adults, then the risk of kind of excessive stress during these situations that may lead to negative health outcomes is minimized. It's significantly reduced. But then we've got what's called toxic stress, and this is the most dangerous type of stress response, and occurs when children experience frequent or prolonged activation of that stress response system. So they have, that adrenaline, that cortisol is frequently activated because they're experiencing so much stress. And some examples of situations that can create toxic stress include child abuse or neglect, or parental substance abuse, or caregiver depression. Some of those situations, again, that are much more frequent and prolonged. So when children face that intense, frequent, or long-lasting adversity, such as neglect, abuse, exposure to violence, poverty, or having a caregiver with a mental illness, or so on, then they may experience what's called toxic stress. And this can cause inflammation in the body that negatively affects the structure of the brain, other organs, and could result in kind of later significant challenges like chronic diseases. The stress response system, which is described here, which includes the hypothalamic pituitary adrenal axis, stumbled over that, and the sympathetic nervous system is really crucial to maintaining the body's response to stress. And in young children, that system is still developing. And so it can be more sensitive to some of these environmental influences or the environmental stressors than older children or adults may experience. And so when this stress system is repeatedly activated because of these extreme stressful events, it can lead to imbalances in stress regulation, which again can impact the child's brain and body. Children, the brains of children are more plastic, or we talk about the plasticity of the fetal, infant, and early childhood brain. And again, because of that plasticity, it makes the brain more sensitive to chemical influences. And so there's, evidence that elevated levels of stress can disrupt the developing brains, and particularly the amygdala, the hippocampus, and the prefrontal cortex. The extremely stressful childhood events are sometimes referred to as adverse childhood experiences. And this term really gained attention after a study conducted by some folks at San Diego's Kaiser Permanente and the Centers for Disease Control and Prevention, where they surveyed thousands of primary care patients and collected information about their childhood trauma and then their current health status as adults. And the study identified these 10 traumatic childhood stressors that were strong predictors of negative lifetime outcomes. And so you can see these are the 10 most studied adverse childhood experiences that are organized according to abuse, neglect, and household dysfunction. So ACEs are fairly prevalent. That initial study on ACEs demonstrated that ACEs are fairly prevalent across all populations. And here are some Georgia data that show that looking at overall, so we know that about 1 in 6 people in the US have experienced 4 or more ACEs. But looking at Georgia, specifically, you can see some of the the data here that a good, 40% of, for about 45% of children in Georgia have experienced at least one ACE per the data from 2018, 2019. So what can we do about ACEs in early trauma? Well, here are some broad suggestions. Address structural challenges, promote secure infant caregiver attachment, which was described earlier, promote healthy relationships, promote parental self-care, promote social emotional competence, and make sure that all have access to community resources. So first, when looking at structural challenges, we want to create environments that promote safety, stability, and nurturing relationships for kids. And I talked a little bit about that public health model of prevention, where we can organize kind of our supports around kind of universal supports and programming that all families and children have access to, some of those more targeted supports and programming that families and kids who are considered kind of quote unquote at risk have access to, and then those really intensive individualized supports for families and kids where there's demonstrated concern. So then, that's again one way to address structural factors that contribute to trauma, is ensuring that there's access to different levels of resources. So then the next step is to promote healthy relationships. And talked a little bit about this earlier, but here's a quote that I like. "We know that strong and nurturing relationships are the most effective way to protect children from the impact of negative experiences and to help them heal from trauma." And this also as well, when little people are overwhelmed by big emotions, it's our job to share our calm and not join in their chaos. So young children need us to model healthy emotional regulation. They need us to be their safety. They need us to be their security. And often what we need to do to promote those healthy relationships is ensure that we are taking care of our own mental health. And so looking at this next item, if you'll look at items 11 and 12 in your activity packet. Note that, there are clear signs of burnout. Families are tired of being a parent or caregiver is hard. We all know that. We've all likely experienced caregiver burnout at some point. And if we have children with neurodevelopmental differences or other challenges, in our personal lives, we may have reached burnout much earlier. So we all cope with burnout in our own ways. And so I'd love to hear, have you all described in the activity packet number 11, what's one strategy that you use to take care of your mental health? So go ahead and pause the recording briefly and note one strategy that you use to take care of your mental health. Okay, well, welcome back. So I'm going to talk a little bit about some of the domains of self-care, but first I want to describe what self-care is. So self-care includes the habits that we build that help us stay healthy and at the top of our game. It's important because it allows parents to feel at their best or caregivers to feel at their best. And, as caregivers who are engaged in self-care, we're more likely to feel confident, enjoy parenting, overcome frustration more easily. And so there are 6 domains of self-care: physical health, maintaining physical health, emotional health, social, spiritual, psychological, and professional. So some examples of activities that can be done to address physical health are listed here. So exercise on your own and as a family, sleep, eat right, drink more water. If you're struggling with any of these, seeking support from a medical provider, but making sure that families are taking care of their physical health. Also making sure that families are taking care of their emotional health. And oftentimes we have to make sure we're taking care of our physical health before we can take care of our emotional health. So identify activities that make you happy. Allow yourself to feel your emotions. Say no to extra responsibilities that aren't required. Give yourself alone time and give yourself affirmations and encouragement. And then there are strategies to address social self-care. So making sure that we have a support network and friends that can be there for us when we need them, that we can have fun with. Find a way to have weekly time if we have a partner, weekly time with that partner, and schedule time to talk to other adults each day if you're spending most of your time with young children. And then our spiritual and psychological self-care. So maybe we would benefit from working with a mental health provider. Speak to someone who you trust in your life, whether that's someone in a community of faith or a mentor, and engage in self-reflection practices such as journaling, meditating, poetry, spending time outside, etc. And then we look at professional self-care. So set professional limits and boundaries, make sure you take time off, make sure you say no to unnecessary tasks, and make sure you have quiet spaces to complete tasks. And then so next we want to make sure that we are promoting social emotional competence in our young children. And so here is some information about social emotional competence. So social emotional competence refers to the child's ability to create and sustain meaningful relationships with children, other children, and adults. And so why is this important? So we've been talking about this really through our whole time together today. So social emotional competence allows kids to share their world with others and to learn self-regulation and build resilience. So social emotional competence is really considered synonymous with early infant and early childhood mental health. And so there are ways that we can promote children's social emotional competence through encouraging positive interactions with ourselves and children. We can do this through some of the strategies listed here. So make sure that we're smiling at children and laughing with children and gentle and nurturing them through gentle touch. Make sure we're understanding what the child's needs are and how those needs may change. Make sure that we have a space for children to be creative and have self-directed play, and that we're responsive to children when they're expressing their needs to us. So we also want to promote think about the different ways in which we can promote social emotional competence by age. So certainly the way we're going to engage an infant and a baby is going to be very different than the way we're going to engage a 5-year-old. Maybe the general principles will stay the same, but the specific activities may change. So, with an infant and toddler, we may hold the baby while we're feeding them, which we're not necessarily going to do with the 5-year-old, but we may be patient and responsive to the many, many questions that 5-year-old children have. So we want to make sure that we're being cognizant of the different needs of children as they age through early childhood. So I'm going to show you a video now that shows some questions that families can ask themselves, or we can support families in thinking through, and they to help them identify whether or not their child may have a delay in social emotional development or maybe early childhood mental health concerns. And so I think that this video does a good job of asking us questions about development that we may not ask. So rather than just looking at a list of developmental milestones, here are some things to think about when we're thinking about whether or not there are some early social emotional or mental health concerns with our children. So we'll go ahead and play the video now.
Hi, I'm Dr. Steve Schlossman. I'm a child psychiatrist and a consultant with the New York State Project Teach program. I want to take a minute to talk with you about some of the changes you may want to look out for when it comes to your child's mental health, specifically if your child is between the ages of 0 to 5. It's important to utilize your child's pediatrician for mental health concerns, as well as other kinds of illnesses. Remember, you know your child best, but your doctor knows how to recognize an emerging problem. In other words, you might not be sure if there's a problem, and that's what your doctor is there for. Your concerns as a parent will obviously change as your child grows, But right now, I'd like to share some questions to think about if your child is under 5. During these beginning years, your child is mastering all the things most of us take for granted: sleeping well, eating appropriately, relating to others, using words and being able to tell stories. These are the ways humans interact. And amazingly, we master these tasks in the first 5 years of life. Because of this, try to focus on the really basic things. Look at sleeping, eating, talking, and playing. Remember, these are only rough guidelines. Shape your thoughts based on what you know about your child's unique needs. For sleep, ask yourself, does your child sleep through the night? If not, how often does he or she wake up? How long does it take your child to fall asleep or to fall back asleep? Does your child have nightmares? Does your child remember the nightmares the next morning? Remember, very young children, and certainly infants, won't know how to describe a nightmare. Some children will even have a hard time knowing that an unhappy dream isn't real. Think about whether your child wakes up in the middle of the night feeling extremely frightened or sad. If this happens often, does your child appear to remember these events the next morning? Does your child ever wet or soil the bed? If so, how often? When does this happen? What is your nighttime routine? Does it vary? For eating, keep these questions in mind. When does your child eat meals? When does your child snack? What does your child eat at meals and at snacks? Is your child a picky eater? What are some favorite foods? For speech, decide. Is your child a big talker? Have there been changes in your child's vocabulary? Can you understand what your child is saying? Does your child tell stories? Can your child understand what you're saying? Will he or she listen to your stories and ask questions about them? Can your child follow instructions? How many steps of instructions can your child follow? For play, watch your child and consider, how does your child play? Do they play with friends or next to friends? Does your child have a best friend? Does your child have a group of friends? Does your child have an imaginary friend? Does your child draw? If so, what does your child draw? Does your teacher or child care provider have any concerns about your child? Does your teacher worry about your child's ability to pay attention? And finally, for family and family changes, ask yourself, is there any chronic family stress, or has a significant life event taken place within your home that may affect your child's well-being? For example, separation or divorce, moving to a new home or community, the birth of a child with special needs, or a serious medical diagnosis in the family. Make sure to let your child's pediatrician know if these or other significant changes are occurring in your family. Remember, there's no wrong answer to these questions and no answer that guarantees there's a problem. But if your answers make you think, look at your thoughts as an opportunity to ask more questions. And definitely involve your doctor in these discussions. To find more information about what social and emotional developmental milestones children reach at this age, take a look at the Guide for Parents of 1 to 5-year-olds. It's a brochure on the Project Teach website.
Okay, thank you for watching that. And here is a snapshot from that resource that he just described. And it really is a great resource that goes very deep into social emotional developmental milestones across the age range of early childhood. And so this is a free resource and available to you. Then the last thing that we can do about ACEs and early childhood trauma is really look at what community resources may be available. And so we look at what are the systems level resources available. well. And one great resource is the Georgia Association for Infant Mental Health, Birth to 5. And this is housed at Georgia State University. And they provide a range of programs, workforce development programs for targeting the infant and early childhood mental health workforce. And they have a resource list of providers across the state who are providing these types of supports for families. So Georgia AIM is currently providing foundational trainings on infant and early childhood mental health, like this training that you're attending. They're supporting the endorsement of infant mental health professionals. They're looking at how infant and early childhood mental health principles can be woven into higher education curriculum. They're currently providing training on circle of security and child parent psychotherapy in DCE 0 to 5, which I'll describe briefly next. And then they have worked at the policy level to help ensure that providers can get reimbursed for some of these services. So looking at what Circle of Security is, so this is a targeted support for families. It's a model of intervention that's really grounded in attachment theory, and it's based on the idea that attachment problems in infant and early childhood increase the likelihood that a child may have mental health concerns in life. And so it also recognizes that the quality of the attachment relationship can change. So if a child or caregiver gets a rocky start to their attachment relationship because of some trauma in the family, that attachment relationship can be repaired. It also helps caregivers recognize the influence of how they were parented in their own childhood and how that might be playing out in the caregiving of the children in their care. So, there are a lot of different efforts in Georgia focused on supporting child protective services families, so foster care families, and other caregivers in learning Circle of Security and being able to use Circle of Security. So then there's also a statewide effort on promoting child parent psychotherapy, and child parent psychotherapy is a therapeutic approach for kids 0 to 5 and their families. It's really an evidence-based practice for supporting young children who've experienced trauma of any type. It can also be appropriate if families are just concerned about a child's challenging behaviors. It really supports family strengths and relationships, helps families heal and grow after stressful or traumatic experiences, and then is very responsive to the family culture. So there's been quite a bit of training in Georgia, like I said, on child parent psychotherapy, and there's going to continue to be training on child parent psychotherapy, so that there are trained clinicians across the state. So you can contact Georgia AIM to find out who is trained on child parent psychotherapy in your area. And then also there is a diagnostic manual for disorders of early childhood, and Georgia AIM has provided overview and clinical training on the use of this manual so that clinicians who work with young children are able to better understand common disorders of early childhood and diagnose those. And then finally, there's recognition that if the mental health workforce is going to be trained on these models, they need to get paid for providing sessions to families. So there's been a team working on clarifying the Medicaid guidance for clinicians who are trained in these early childhood clinical models. So you can find this information on the state Medicaid website. So thank you so much for participating in this training today. And I will ask you to, before you leave, to take a picture of this QR code and complete the post survey so that we can get a sense of whether or not you gained any knowledge and through the training, and also just want to get your feedback on the training and want to be able to improve it and make it so it's as relevant for you and future audiences as possible. So I'll leave this QR code up for just another few seconds, and then we'll end the recording. But thank you so much again for your time.